In today's video, I want to tell you what you may experience as side effects of EMDR therapy. So if you're considering EMDR therapy or if you've started going to therapy, but something's not feeling quite right, this video is for you. Hi there, my name is Ashley Phillips and I'm a certified EMDR therapist. I'm also the founder of the Kelowna EMDR Clinic, where my team and I help clients heal from trauma and overcome trauma-related symptoms like anxiety and chronic stress. If you are new to this channel, welcome, and make sure to subscribe so that you are notified when the next video drops. So first, I want to set some expectations. People sometimes have this idea that they will feel amazing after every single therapy session. Sometimes that's going to be the case, but when we're dealing with past trauma stuff, you may feel worse before you feel better. Yes, at the end of the treatment protocol, you can expect to feel much better. But during treatment, it's normal to have some ups and downs. So let's talk about what you may experience, why it can happen, and what can be done about it. Let's start with the basics. EMDR is a trauma therapy, and at various points, you're going to be asked to revisit traumatic memories. That exposure is essential for memory remodeling and desensitization, but it can be activating. Before you ever get to the reprocessing part of EMDR, a good therapist will teach you self-regulation strategies to make sure that you're ready. And this is all part of phase 2 preparation. If you're new to EMDR and you're not familiar with how this therapy works, I highly recommend you watch a series of videos I did explaining the 8 phases of EMDR therapy. I'll put the link to the video playlist below. Okay, back to the main topic. When we both feel that you have the right tools and we've got a good, safe, therapeutic relationship that's been established between the two of us, we'll go on to reprocessing. Common side effects after reprocessing include insights, awareness of forgotten memories, which can feel really new, fatigue, vivid dreams, and sometimes nightmares, as well as like a general heightened emotional state that can make you feel more energized or make you feel more irritable and moody. These side effects are perfectly normal. Is it a sign that things are working? Yes. And if we don't experience anything, it doesn't mean that it's not working. Every person is different. And even though some side effects like nightmares and irritability are definitely unpleasant, they should resolve themselves after about 24 to 72 hours. So what if it doesn't stop after 3 days? Please talk to your therapist about this. It can mean a variety of different things, such as that we need more preparation, we need more closure time at the end of our session where we use those relaxation strategies. We might need more psychoeducation on what to expect between sessions, or the reprocessing was too intense, which means we need to slow it down so that it's in alignment with what your nervous system can tolerate. To make sure that my clients are not caught off guard after a reprocessing session, I'm going to say something like this to them. Processing may continue after our session, and you might or may not notice new insights, thoughts, memories, physical sensations, or dreams. You might feel more energized or more fatigued. You might feel more calm or you might be more irritable. Please make a note of whatever you notice, and we'll talk about it at our next session. And always remember to use the self-control techniques as needed. It is important to use a journal to see what you're noticing and use the strategies that you've learned along with what you know works well for you to help you ground and stabilize. Think of it as like intense self-care after reprocessing sessions. If you've gone to EMDR therapy, I'm really curious about your experience. Did you have any negative side effects? Tell me in the comments below. Another side effect that you can experience after reprocessing with EMDR is dissociation or going numb. Dissociation is when we disconnect from our thoughts, our feelings, our body sensations, memories, or sense of identity. It's our brain's way of coping with overwhelming stress or trauma by mentally escaping a painful or difficult situation or memory. The chances of dissociation can increase when there's a very high level of distress as we're reprocessing the memory, and it's something that I, as an EMDR therapist, have to be very cognizant of. Sometimes clients will dissociate in session. The telltale signs I'm going to look for is noticing a shift in their eyes and their body. Their eyes are no longer tracking the light bar. They suddenly have a headache or a migraine. They say they feel spacey or numb, and they say, like, I don't know, when I ask them what's coming up. When I notice that the client is dissociating, I immediately stop reprocessing and I help them come back to the present moment. I have many techniques that I use with my clients, such as doing mental math, naming countries, tossing a soft pillow back and forth, and standing and doing some sort of movement. Dissociation in session is one thing. Your therapist can help you manage it. But dissociating after your reprocessing session is quite different. It's more serious, and honestly, if it's happening to you, there's a good chance that your therapist might have missed the mark with not taking a thorough enough history, jumping into reprocessing too quickly, not doing enough preparation work, not catching what was happening during the reprocessing session, or not closing the session appropriately and leaving you in an unbalanced state. Your therapist's job is to make concerted attempts to help you come back to a balanced state and regulate. Another thing is that the target might have been too intense to reprocess, and we need to slow it down. It's important that during phase 2 that your therapist teaches you about dissociation and how it shows up for you and how to manage it. I like using the back of the hand. It's where I have the client put their hand out in front of them, and this is like, I am fully here, fully present. And then this is going back. This is, I've dissociated, I'm no longer here, and I'm not present. And I encourage people to set a reminder with their own sound to remind them to check in and see where they're at and physically putting their hand back and forth here. If we're about here and back, we want to come and use the tools that we're learning to help them be more in the present moment. Now, if it's about time to end the session and the client is not grounded, you do not let them just leave. You work with them until they're back into a balanced, regulated state. A client should always leave grounded and in a balanced state. We also want to help them make a plan for the rest of the day for good regulation activities, such as going for a walk, going to yoga, seeing a friend, or maybe watching a feel-good movie. I typically recommend that they already have their plans in place before they come into session, so it takes away the mental load of planning. So let's say we have a reprocessing session where you felt a high level of distress and you left in an unbalanced and unregulated state. And now it's a couple of days later and you're still really dissociating and checked out. Here's what you're going to do. You're going to call your therapist. It's part of our training to tell clients they can call us in between sessions if they're having a tough go or if they have questions. And that is so critically important. So to sum it up, the reprocessing phase of EMDR therapy can very often be quite activating. And to set up for success, I, as a therapist, will explain to you what to expect and provide you with tools and techniques that you can use during the preparation phase. After reprocessing, you may experience resurfacing of old memories, more vivid dreams, including nightmares, general fatigue, and heightened emotional states. The best way to handle this is to notice what is happening for you, recognize that this is perfectly normal, use grounding techniques that you were taught during the preparation phase, and go from there. That's it for today. Hopefully you found this video informative. If you did, give it a thumbs up. And if you haven't already, subscribe to my channel for more videos on EMDR therapy and private practice. Bye for now.